So in the beginning stages, we're not really too worried about doing a knee foot application. So like a small hernia isn't too big of a deal as long as their symptoms aren't like super bad, especially if they're older. It's not really going to progress super far. They're going to die before it hurts them like crazy. So usually we don't do medical management for hernias unless it's really severe. Okay. If we have a problem in the stomach that we're not really sure what it is, we can do a transthoracic surgery where they just make this huge incision from like up here, sometimes even higher, all the way down, and they kind of just look around and try to figure out what's wrong. And they'll fix the problem right then if they can, or they'll make the diagnosis. I had a patient who had this, and her incision was massive, and they just let it heal from the inside out. So she had this huge wound vac in, just stuffed right there. So, yeah. Basically, with those patients, they're going to be in a lot of pain because they've got a really high incision. You need to teach them deep breathing, pretty much all the things to avoid pneumonia.
But it says the high incision makes deep breathing extremely painful, so
medicate them up like crazy.
But not with morphine, because it would probably make it worse. Not as far as the
respiratory rate would go down, but lots of times. I don't think I've ever had a patient have respiratory difficulties with morphine though, so it doesn't really make their respirations go down too much.
Okay.
Like you always want to assess for that, but I've never had a problem with it before. So.
Well, that's good.
All right, just a quick overview of esophageal tumors. So we've got a tumor in our throat. What are some complications that we could have? Good. Airway is the huge thing. We want to make sure that we're assessing that tumor isn't obstructing their airway. Esophageal tumors, by the time that we find them, usually they've metastasized. And so lots of times we won't really do much about them unless they're blocking the airway or they can't swallow. We'll just kind of leave it there, and because they're probably going to die from it because they're kind of stinks, yeah. Metastasizes to other places.
So do they not get like symptoms of an early tumor?
Not an early. It's silent pretty much until
it's too
late. Mm-hmm. Yep. Also, if we decide to remove the tumor because it's blocking too much the airway or blocking too much the esophagus, then we want to assess for airway still because they might have inflammation around that surgical site. So, airway is always number one. Okay, we've kind of already gone over diverticula. With pretty much all of these, like especially diverticula, why do we want to encourage fiber? Like, what does fiber do?
Fiber helps with your bowel movements, but you got to make sure that you are well hydrated also, otherwise it's just going to make it worse.
So what does it do with your bowel movement?
It's
bulk.
Good. Provides bulk. So if we've got diverticula, it's going to help it pass through the esophagus easier rather than just lodging in those diverticula. So lots of times with diverticulitis, or like in the esophagus that is, they will just kind of like rinse all those diverticula out with like lots of fluids, and then we'll make sure to encourage lots of fiber in the diet, and it's usually fine. So if they don't have too much of it. All right, what is the difference between gastritis and gastroenteritis?
It's like ends and terminal. I don't know if that makes a difference. Is gastritis just like the stomach in general?
Yeah, it's just an inflammation of the stomach. It's not viral. It's not infectious or contagious. I mean, usually it's caused by like irritation. It can be caused by food poisoning, because if you get food poisoning, you're not going to spread it to somebody else. It can be caused by bacteria, specifically H. pylori or E. coli. So
is this what happens when you have like nausea and vomiting?
Gastritis?
Yes, with gastritis, you're gonna have, you'll have nausea, vomiting, you'll lose your appetite, you'll kind of have abdominal discomfort. So basically a lot of the signs and symptoms of gastroenteritis, but there's one outstanding one with gastroenteritis that kind of sets it apart from gastritis. Do you know what that is? It's not coming up, but it's going up.
Going down, so
Yeah.
diarrhea.
Watery diarrhea.
Okay.
Isn't that what they call this, like the flu, the stomach flu?
Yeah. Is gastroenteritis. It's the stomach flu. So gastritis, basically all you're watching for is fluid and electrolytes, making sure that they're hydrated because they're puking. It kind of resolves itself though. If worse comes to worse though and they're having electrolyte problems, we might give them antibiotics to get rid of it quicker. But usually it resolves itself within at least, or at most, a couple of days. So with gastroenteritis, what do you think some complications of this will be? Or some nursing things we might want to watch for?
Dehydrated.
Good, dehydration. And with dehydration, what are we going to watch for?
Electrolytes.
Good, electrolyte levels. So they're going to have nausea, vomiting, abdominal discomfort, watery diarrhea. We can stop the vomiting, but why wouldn't we want to stop the diarrhea?
Because it's getting rid of it.
Good. That's what's getting rid of whatever is causing the problem. The vomiting is also getting rid of it, but it's super uncomfortable to vomit, so you'd rather have diarrhea than vomiting.